It is very misunderstood. It's probably the most stigmatised against disorder. In some sense, because it's about cognition, it's about perception, it's about belief, it's almost one of the most human disorders that exists. It's kind of at the core of being a human being.
Because I didn't realise at the time that that sort of high and low was going to be for the rest of my life. Unbeknownst to me, I think I've been bipolar all my life. We're talking life and death issues here. We're not talking about some namby-pamby, can't get out of bed because he doesn't want to go out of bed, or whatever it might be. It's a little bit more serious than that.
Yes, absolutely.
We're going to talk about postpartum psychosis, but we really need to find out what postpartum psychosis is like for a sufferer.
Yeah.
Now, you've been incredibly brave to agree to talk about it. So, can you tell me a little bit about your experience of an episode of postpartum psychosis?
Yeah, absolutely, yeah. And when I had my first child, my daughter, I thought, you know, everything would be fantastic, as everybody does with their first baby, and the pregnancy went very well. And when I came home, like a lot of mums, I spent a lot of time up in the night, you know, trying to breastfeed and backwards and forwards but I started to get more and more hyper, really, to the point where I knew it was not normal.
A bit flatter than I have been over the course of the films. What normally happens is I go into these flat days and they sometimes turn into bad days, and if you get a lot of bad days, i.e. more than say 21 days really not very well, it can lead into a suicide attempt. So I'm not at that stage, but I am very conscious of the fact that I'm very vulnerable at the moment. It either will sort itself out or it will end in a clinical depression, which means I have to be very, very careful about what I take on, what I do, what my stresses of my life are. If we can get out of this flatness of mood and get a bit of motivation to walk the dog, that'll probably help me mood level, and hopefully that'll come into place. So I need that sort of like motivation, get the gig sorted out right, get the gig planned right in my head, and have 12 weeks worth of walking pebbles, so that means I can move my body in time and to the music and that sort of stuff. I haven't got a clue what postpartum psychosis is. So what is postpartum psychosis?
Well, there's a spectrum of illness, that mood disorder that comes on after childbirth, from the very common, what's sometimes called baby blues, which can affect perhaps 50% of women or more, and that's just a few days of transient mood lability often. Then there's postpartum depression that affects probably around 1 in 10 women, something like that. But what we're talking about with postpartum psychosis is the very severe end of the spectrum. Women who become incredibly ill following childbirth, usually within a few days or a week or two of having a baby. And they get probably illnesses that are some of the most severe illnesses that we see in psychiatry.
That's nice, Ian. He's a big lad, but the camera loves him.
These women often have mood symptoms, so they can have very high mood or very low depressed mood, but often actually with postpartum psychosis the mood is very variable. It can vary from day to day, from minute to hour, but also common are psychotic symptoms, as the name would suggest, like delusions, believing things that aren't true, or hallucinations, seeing things that aren't there.
Yeah, that's good.
Are we smiling or serious?
Just give us a range of emotions from, you know, yeah, no, yeah. Come on.
You know, I had these slightly scary hallucinations where I remember my brother gave me this brown teddy bear for the baby, you know, as a present. And for some reason, we had very steep stairs in the house I was living in Tooting, and I just remember standing at the top of the stairs and seeing this sort of, you know, the beady eyes of this teddy bear at the bottom of the stairs all the time. And I just kept sort of seeing it all over the place in strange places. And I think, in retrospect, I think, you know, maybe that was in some way my subconscious kind of warning me, you know, be careful, you could do something silly here.
It's okay, I'm mentally ill and I'm under medication and I've got a full diagnosis, so whatever I say is because I'm ill. Oh, I'll tell you what, Ian, can we do some perspective shots in the seats?
Okay.
Can you still get that, Barry?
We know that some women are particularly vulnerable. For women who've had a history of bipolar illness, their risk is something like 1 in 4 or 1 in 2 even. We know that women who have had one episode of postpartum psychosis are at incredibly high risks in future pregnancies. What we don't know is what it is about childbirth that's triggering off these episodes of illness.
I mean, I would be sitting up in bed all night and I had to have the television on, the radio on, writing a novel, you know, going into the baby every 10 minutes. And because I have bipolar disorder and I already had a diagnosis of that previously, I knew, you know, something's wrong here. My head's getting in a bad place.
I want to just probe a little bit further about what triggers postpartum psychosis.
I think that's one of the big questions, and I think that actually question is what is driving the work that we're doing in this area across the universities in Cardiff and in Birmingham University. We have some ideas, you know. These episodes of illness come on at a very characteristic time after having a baby, usually within 2 or 3 days of having the baby. And that's a time where hormone levels such as estrogen and progesterone drop precipitously, drop many hundredfold from their very high levels they are in pregnancy. The other thing that giving birth involves pretty universally is disrupting sleep patterns, and that may be something that can, for some people with bipolar disorder, be a trigger for episodes of illness. There are genes that run in families that make some women more vulnerable to having episodes of illness at this time, and the genes that we're talking about maybe just nudge up or nudge down risk by a small amount. So the approach that we're taking is trying to find out what those genetic factors are, with the hope that they'll give us real clues about what causes the illness and what this trigger is.
That's great.
I eventually went into hospital after 10 days, I think, and I think I was in for about 5 or 6 weeks. You can imagine it's difficult enough if you've had a baby and everybody's asking, you know, say asking your husband, you know, oh, how is she? You know, what's the baby weigh and all that. And you've had to stay in hospital because of high blood pressure or something. But if you say, oh, she's in the local psychiatric hospital and she's not coming home for 3 or 4 months, you know, it's very difficult.
Devastating.
And there's still, you know, a lot of stigma around.
What I'm finding out by doing these films is there's like this umbrella term of mental ill health. So is it fair to say that there are overlaps, say, between schizophrenia and bipolar and postpartum psychosis, and it's, you know, it's just a matter of, you know, severity?
I think that's an excellent question, Twink, and I agree. The labels that we have at the moment are our best guesses, and that's all they are. What we're definitely finding out is that when we look at the factors that we know are important, is that they tend to be shared across these diagnoses.
So the big question, is postpartum curable?
I think that may be the wrong way of putting it.
How would you put it?
Can we do a lot better in helping people live with this condition? I think we probably can. Can we alleviate many of the symptoms that people suffer with now? I think we probably will in the future. Can we develop treatments that have less side effects from the ones that that we've got at the moment? I think that's very plausible. Can we completely cure the illness? I don't know. I'm not so sure. When you're a psychiatrist, when you're dealing with mental health, you're dealing with the big questions of existence, really, big questions of us as human beings. You know, what it is to be, you know, a person.
Ian Jones, thank you very much.
Thank you, Twink.
Killer. I told you he was good. We're putting the effort in. We're rehearsing. We're doing new material. Some days I feel very, very pressured. Other days, not so pressured. My imagination of the gig is way, way bigger than it's going to be. But the amount of emotional investment I'm putting into the 28th of March is what you would expect Oasis to be emotionally committing to at Nebworth. It's a bit, it's that huge a gig for me to go from being a recluse to doing an album and finally getting up on stage in front of some people. At this stage we don't have anything. We've only got ideals and ambitions.
You know, whatever you feel about diagnosis, these individuals have got to are asking for help, and we have to apply evidence-based knowledge to help individuals and recognise as a society that being judgmental is really not very helpful for these children or their families.
Please forgive me, right or wrong.
But tonight and later this week, our science editor, Susan Watts, brings news of medical developments which promise a revolution in the way many mental illnesses are treated, and so literally may offer the promise of life over death.
We don't know enough. We don't know enough about the brain. We don't know enough in research terms about bipolar. But I still want to continue doing the films.
Please forgive me, right or wrong. Please forgive me, right or wrong. I can't live without you.